Monday Health Minutes, sponsored by Valley Health.
Do you ever feel like you need some help trying to figure out how to correct your child's behavior? Do you feel like they're maybe destructive? Are you embarrassed by their temper tantrums? It can be really hard to be a parent. I'm Melanie Schaefer, and today we're talking about PCIT with Dr. Rebecca Denning and how it might be a great fit for your family. First, tell us what that means. What does PCIT stand for?
So it stands for Parent-Child Interaction Therapy, and it is a behavioral therapy meant for parents or guardians of young kids, so typically ages 2 through 6. And these are kids with very strong oppositional behaviors, defiant behaviors, often aggressive behaviors. These are the kids where they're having a hard time staying in their daycare because of those behaviors, or their preschool setting, or where it's just really hard for the family to get through the daily routines because of these behaviors.
So tell us how it's different, because there's a big difference in how this one works.
Yeah, so the biggest thing is that we are working with the parent or guardian and the child in the clinic together while the parent manages the behavior. So what we typically do is we have the parent in a room with the child, and the therapist is actually in another room where we can see and hear what's happening, and the parent will have an earpiece in so they can hear us. And we'll give them instructions and watch how the child is responding to that, and we'll help coach the parents on using the skills that we've taught them so that they are better able to manage those behaviors.
So for example, something is happening, the child is not responding. You say this mom, say this dad. And
Absolutely.
That can change the conversation and the direction of the whole event.
Absolutely, and we stay right with them and coach them all the way through so that they're not in it alone, because these are difficult behaviors.
It's so easy to get in the same pattern. You keep trying the same thing and you're not getting a result. To have somebody tell you the exact right words to say, that's so interesting. Tell me about what kind of behaviors this can address.
So often we're looking at kids who are very defiant, refusing to do the things that they're told to do. And this might be happening at home, it might be happening in preschool settings, in public. Sometimes these behaviors are very aggressive or defiant, cursing, tearing things up, things like this. Sometimes these behaviors make it hard for parents to get help with their kids. Like it may be hard to get a babysitter to agree to come because of these behaviors.
How long does the therapy last? I mean, is it once a week, twice a week, several weeks?
So typically what we do is we're meeting with families once a week, and it's meant to be an 8-week session. Sometimes it goes longer than that because we are going to coach the parents until they reach mastery criteria for each of the skills that we're implementing. And we're going to stay with them until they get to that point and they feel able to manage those behaviors without us.
Tell me about some of the success stories. What kind of turnarounds have you seen?
That's why I love PCIT so much, is we see those results. So we might have a kiddo who comes in and has been cursing and talking about a lot of violent things, has been getting sent home from daycare so much it's impacting their parents' ability to keep their job at work because they have to leave and go get the kiddo. And by the end, they are following basic commands and doing what they need to do. But I think that the biggest difference, even beyond just that compliance, is the change in the relationship between the parent and child. Often when you have a kiddo with all these behaviors, it starts to become hard to enjoy your role as a parent. And as we work through this and things start to improve, we get to the point where we get to enjoy our kids again, where that gets to be a positive, meaningful thing for us.
Yeah, everything's not a fight all the time.
Exactly.
Yeah,
exactly.
So how do you make an appointment?
To make an appointment with this program, you'll just need to call one of the Valley Health offices, and our behavioral health advocate will help you get linked with one of our therapists. We do have 3 psychologists within Valley Health who are certified in PCIT. And so we offer it out of our South Side location, our East Huntington, which is on Route 60, and our Hurricane locations. But if you call any of our offices, they'll help get you linked.
So interesting that this is available. Again, it's PCIT. Dr. Denning, thank you so much for going through what exactly it is and who it can help. I think it's a really interesting option for a lot of families out there.
Thank you.
All right. Thanks for being here for Valley Health Minutes. We'll see you next Monday.